Medical advances are helping wounded veterans overcome all sorts of injuries, from amputations to brain trauma. But there's a less clinical approach many vets at Walter Reed Army Medical Center are embracing. Petty Officer Andrew Holloway has the story of one man and a miracle.
Turn. Come on.
Multiple deployments and a terrible training accident left Sergeant Mike Sella with severe hip and knee trauma and a torn rotator cuff. Then a brain injury, followed by 8 simultaneous strokes.
If you never met me, you just think that I'm a little bit slow and I'm okay.
With more than a few problems to address, doctors went looking for a miracle.
And his name fits him. His name is Miracle.
Other working dogs are trained to help with physical ailments. Miracle is too, but he also provides the paws
Need to push the button.
to let the sergeant think.
When it's a bad day, really bad day for me, I could be walking around and basically blindly end up crossing the street and maybe get hit by a car. He stops and looks at the road crossing and looks for other cars, and then he'll cross.
The dog's been trained to avoid obstacles for him, been trained to stop at curbs so that Mike can think, I gotta cross this street, I gotta look for cars.
Okay.
The sergeant says when his own 2 legs may not be getting the message, his 4-legged fix is in.
He notices if I'm off, and the first thing when you walk into Walter Reed on the first floor is the Warrior Clinic on the left. And if I'm having a bad day and he knows it, even though I don't have an appointment, he tries to take me in there. Let me stand up. Okay.
Miracle is a sturdy steady during an episode of dizziness or simple exhaustion and handles the ups and downs
There you go. Good boy.
of everyday life when they're getting the best of his master.
He will, lay next to me and try and calm me down and try and comfort me.
Miracle also works to put other people at ease.
Takes the stigma away from the disability and opens up a conversation.
He's a very handsome dog, and a lot of people walk up and want to meet him and pet him. And
Sometimes too many people.
yeah, he's a working dog. He may lay down to take a break and rest, but he always wants to touch me in some way.
But even in his downtime, he's on duty. I'm Petty Officer Andrew Holloway, Pentagon Channel News.
So you already know the dark, handsome dog, but who's the rowdy blonde?
That's a boy. Bring.
Raleigh is a therapist in training.
That's a boy. Bring. Good boy. That's it.
The dog's future is bright. In just a few months, he'll be ready to take his place in the Walter Reed Army Medical Center's physical therapy unit.
And we're working with the dog to do a resisted tug-of-war that will help strengthen the veterans' body parts as they're rehabbing.
So I have to resist him.
That works the legs.
Now if I release a handle, he should quit pulling.
And tugging on something in a wounded veteran's hands works the arm muscles. Or he might just work as a sort of soft landing spot.
That Raleigh is right there to act as a counterbalance and a steadying effect as they begin their journey with their new prostheses.
Raleigh still has a few lessons left to learn.
Bring. Good boy. Bring. Gotta work on leaving people alone.
But his trainers say he showed extraordinary promise early on.
Eye contact to me is a really nice sign that you're trainable. If they look at me in the eye, then they're confident and they're usually trainable.
It is a program of love, patience, and repetition.
Well, maybe one thing more than another.
Patience, patience, and patience.
And a role model named Miracle can't hurt either. For the Pentagon Channel, I'm Marine Sergeant Ashley Bryant.